NCLEX-RN Medical Surgical Nursing Mock Test 1. Cardiovascular System. 1. A client is admitted with chest pain. Which finding most strongly suggests myocardial infarction? A. Chest pain relieved by rest. B. ST elevation on ECG. C. Pain increases on inspiration. D. Bradycardia. Rationale: ST elevation is a classic sign of an acute MI due to complete coronary artery occlusion. 2. A nurse administers nitroglycerin sublingually. What is the expected effect? A. Increased heart rate. B. Vasodilation and decreased preload. C. Bronchodilation. D. Hypertension. Rationale: nitroglycerin dilates veins and arteries, reducing myocardial oxygen demand. 3. Which lab value is most specific to myocardial injury? A. CKMB. B. Troponin I. C. Myoglobin. D. BNP. Rationale: troponin I is the most specific and sensitive indicator of myocardial infarction. 4. The client on furosemide complains of muscle cramps. What should the nurse do? A. Give high sodium foods. B. Assess potassium level. C. Restrict fluids. D. Administer calcium. Rationale: furosemide can cause hypokalemia, which leads to muscle cramps and arrhythmias. 5. A patient with heart failure is prescribed Enalapril. Which side effect is most concerning? A. Dry cough. B. Dizziness. C. Angioedema. D. Fatigue. Rationale: angioedema is a rare but serious and potentially fatal allergic reaction to ACE inhibitors. 6. A client with heart failure reports 2 kilograms weight gain in 2 days. What does this indicate? A. Improved appetite. B. Inadequate nutrition. C. Fluid restriction is working. D. Worsening fluid retention. Rationale: a gain of 2 kilograms in 2 days indicates fluid overload, common in heart failure exacerbation. 7. Post-pacemaker insertion. Which instruction is appropriate? A. Avoid lifting the arm on pacemaker side above shoulder. B. Sleep on the pacemaker side. C. Massage the site twice a day. D. Wear tight clothing over the site. Rationale: arm movement restriction prevents dislodgement of pacing leads during the healing phase. 8. The nurse is about to give digoxin. Which action is necessary? A. Monitor BP. B. Check blood glucose. C. Check apical pulse before giving. D. Check pupillary response. Rationale: digoxin can cause bradycardia, hold a apical pulse less than 60 bpm. 9. Which symptom most suggests left-sided heart failure? A. Peripheral edema. B. Tachycardia, crackles, restlessness. C. Distended neck veins. D. Hepatomegaly. Rationale: these are signs of pulmonary congestion due to left-sided HF. 10. What is appropriate client teaching for hypertension management? A. Sit with legs crossed. B. Drink more fluids. C. Keep legs uncrossed and feet flat. D. Increase salt intake. Rationale: proper posture during BP measurement ensures accuracy. 11. A patient with heart failure is placed on a sodium-restricted diet. What is appropriate? A. 4G sodium. B. 3G sodium. C. 2G sodium diet. D. Regular diet. Rationale: sodium restriction prevents fluid retention in heart failure. 12. The ECG shows frequent PVCs. What action is appropriate? A. Administer digoxin. B. Administer furosemide. C. Check potassium level and obtain ECG. D. Administer morphine. Rationale: electrolyte disturbances, especially hypokalemia, can cause PVCs. 13. A client on warfarin has an INR of 4.0. What should the nurse do? A. Give double dose. B. Hold warfarin and notify provider. C. Give vitamin K. D. Administer heparin. Rationale: INR greater than 3.5 indicates increased bleeding risk, provider should be notified. 14. A client with suspected DVT should avoid which action? A. Ambulating with compression. B. Elevating legs. C. Massaging the calves. D. Wearing elastic stockings. Rationale: massaging may dislodge a clot, leading to pulmonary embolism. 15. A client with atrial fibrillation is receiving heparin. What lab must be monitored? A. INR. B. Hemoglobin. C. APTT. D. Troponin. Rationale: heparin affects APTT, therapeutic range is 1.5 to 2.5 times normal. 16. A nurse prepares to administer 4-metoprolol. What is the priority assessment? A. Respiratory rate. B. Oxygen saturation. C. Heart rate and blood pressure. D. Capillary refill. Rationale: beta blockers slow the heart rate and reduce BP. 17. A client with new-onset atrial fibrillation is at risk for A. Hypertension, B. Thromboembolism, C. Pneumonia, D. Cardiac tamponade. Rationale: irregular atrial contractions can lead to blood stasis and clot formation. 18. Which is a modifiable risk factor for coronary artery disease? A. Gender, B. Age, C. Smoking, D. Family history. Rationale: smoking is a modifiable behavioral risk. 19. A client has a BP of 88/58 and reports dizziness. The nurse should A. Encourage fluid intake, B. Place the client in supine position with legs elevated, C. Administer antihypertensives, D. Ambulate the client. Rationale: this promotes cerebral perfusion in hypotension. 20. The nurse assesses a client with pericarditis. Which finding is expected? A. Bradycardia, B. Crackles in lungs, C. Pericardial friction rub, D. Bounding pulses. Rationale: a pericardial friction rub is a classic sign due to inflamed layers rubbing together.